Florida and Texas announcing a pause in their reopening plans as coronavirus cases continue to climb. Separately, the CDC says it's possible that the number of infections in the U.S. could be 10 times higher than the confirmed case count. Joining us now is Dr. Scott Gottlieb. He's a former FDA commissioner. He's also a CNBC contributor and serves on the boards of Illumina and Pfizer. Even if it would be 10%, Scott, and that's what Dr. Redfield was talking about, that still leaves 90%. Non-immune that haven't seen the virus. So that, I don't know, 10%, it's amazing that it's that high, and it makes the mortality rate look more manageable, if manageable is a word you can use. It doesn't make it look as bad, but it still leaves a lot of people that would be obviously vulnerable to the virus.
Well, what Bob said, what Dr. Redfield said is that we're probably diagnosing 1 in 10 infections, and he said that the seroprevalence, the actual number of Americans who've had the coronavirus, is somewhere between 5 and 7%. I think he said maybe 5 and 8%, which is probably right. I think, and that's what we've been saying on this show for weeks now. We're probably diagnosing right now, I would say we're diagnosing 1 in 5 to 1 in 10 infections now. At the height of the epidemic, we were probably diagnosing closer to 1 in 20. And as far as the percentage of the total population that's had it, I would guess it's around 7% right now, because it's been, extending. It was 5% probably at the end of the sort of peak of the epidemic back in May. But in cities like New York, it's much higher. It might be as high as 30% in New York City. Boston, Detroit, New Orleans, probably around 10%. Los Angeles might be closer to 10% right now as well.
So why is the positive that deaths are down 60% or two-thirds with these cases rising? So that means these are younger, asymptomatic type people, or we're treating them more effectively? Are we using remdesivir or dexamethasone, or are they getting to the hospital more quickly? What's the difference there?
Well, the fatality rate probably is down, although we can't measure that. We don't know that for sure in terms of the fact that we're preserving more lives. So your likelihood of dying of coronavirus probably is going down as a result of better treatment. But it's down also because the cases are down, first of all. And second of all, it's in a younger population right now. So the average age of a coronavirus patient who's presenting to the hospital for hospitalization or being diagnosed is much lower than it was. The worry would be that we would look a lot like Iran. Iran had an epidemic. They started to come down. They plateaued like we did. And then they had, it's not really a second wave. They had another spike in infections. And in about 3 to 4 weeks after that spike in infections, their death rate went up back to where it was. So there is a delay in the time to death. And so we're going to see the death rate, unfortunately, go back up. Hopefully it doesn't go back up to the levels it was at. So if you figure right now that we're diagnosing 1 in 5 infections, which would probably be the best we're doing. So maybe there's 150,000 infections a day in the United States, and we're recording, or we will soon be recording, about 800 deaths a day. That's an infection fatality rate of 0.5%. Right. And that might be right. We might be around 0.5% now.
Which is bad. Talking about the next 2 weeks are crucial. Everybody, Dr. Fauci, Redfield, others, I think you've even mentioned that. So what's going to dictate the next 2 weeks? Have we taken precautions in the vulnerable places to deal with the next 2 weeks, or we're rolling the dice and we're just going to see what happens?
I think it's the latter, Joe. We really haven't. They've paused the reopenings, and I think people are going to be more cautious on their own. They're now talking about, you should wear a mask, you should try to stay home. So maybe people will heed that sort of soft advice. Yeah. But if they don't, this is going to continue to expand. And, the question is, are they experiencing exponential growth? Texas is testing a lot, so they're turning over their cases. Florida's not. Florida testing is actually down. So Florida may be in worse shape than Texas. We just don't have as good of a picture into Florida. I would also be very worried about smaller states like South Carolina and Alabama, which don't have the health care resources that big states like Texas and Florida do.
But not New York and New Jersey.
Texas, Florida, California.
People are out and about.
Not right now.
I'll just tell you that. People are out and about. I see it in where I live. And I'm just wondering, have we put it to bed here?
We're never going to put this to bed. We're going to have to get through one more cycle with this. But it takes weeks and weeks for really an outbreak of the size that's going on in Florida and Texas to build. That had been going on for weeks. So, New York, if we start seeding infection and start spreading now, we'll see the consequences of that in 4 to 6 weeks.